Welcome back, future nurses. You have officially landed on day 20 of our unstoppable 30-day NCLEX challenge. And let us just take a moment to appreciate how far you have come. You are now 2/3 of the way through this journey. And that means you have already mastered more than 1,250 high-yield NCLEX questions, including pharmacology pitfalls, prioritization puzzles, delegation dilemmas, and all those tricky clinical reasoning scenarios that the NCLEX loves to throw your way. Honestly, if you are still here, grinding it out day after day, then you are not just preparing. You are transforming into a confident, clinically sharp, and exam-ready nurse. And because we know how hard you're working, we have something special lined up just for you. For a limited time, we are offering free 5-day access to our all-in-one NCLEX crash course. And yes, it is totally free. No credit card, no commitment. Just click the WhatsApp link in the description below and send the word, "Hi." That is it. Our team will unlock live-in recorded NCLEX review sessions, powerful next-gen NCLEX case studies, over 5,000 exam-style practice questions, printable PDF study guides, expert Q&A support, and personalized study schedules for both fast-track and full-month prep. This is your chance to level up your prep and get that final boost before test day. And it will not cost you a thing. So now, let us lock in that focus and get ready to crush Practice Test 20, which is filled with clinical gems and real-world nursing challenges. Grab your notebook, close those tabs, and take a deep breath. You are 10 tests away from the finish line, and we are right here with you every step of the way. Let us dive in. Let us begin with question 1. A client is scheduled for hip replacement surgery in 2 hours, and the healthcare provider has prescribed intravenous tranexamic acid. Which finding would best indicate that the medication has achieved its intended effect? Here are the options. A. Minimal postoperative pain. B. Improved lung expansion. C. Reduced intraoperative and postoperative blood loss. And D. No signs of wound infection. The correct answer is option C. Reduced intraoperative and postoperative blood loss. Tranexamic acid is an antifibrinolytic that helps prevent the breakdown of clots, making it especially effective in surgeries like hip arthroplasty, where blood loss can be significant. Option A is incorrect. This medication does not relieve pain. Option B is unrelated, as lung expansion is influenced by respiratory interventions, not tranexamic acid. Option D is also incorrect, since this drug does not prevent infections. Now for question 3. The nurse is preparing to discharge a client newly diagnosed with pulmonary tuberculosis who is starting a full course of antitubercular therapy. Which lifestyle behavior would place the client at the greatest risk for a serious adverse drug reaction? Here are the options. A. Living with a roommate and working as a flight attendant. B. Having a hormonal intrauterine device in place. C. Smoking 1 pack of cigarettes per day. And D. Consuming 3 glasses of red wine daily. The correct answer is option D. Consuming 3 glasses of red wine daily. The primary tuberculosis medications, isoniazid, rifampicin, and pyrazinamide, can cause liver toxicity, and alcohol use further increases this risk. Clients should strictly avoid alcohol during the 6 to 9 months of treatment. Option A addresses public health, but not drug toxicity. Option B is incorrect, as hormonal intrauterine devices remain effective with rifampicin. Option C is unrelated, since smoking does not directly interact with tuberculosis medications. Here comes question 4. The nurse walks into a hospitalized client's room and discovers a fire has broken out. After safely removing the client from immediate danger, what should the nurse do next to ensure the safety of others and begin the emergency response process? The options are A. Activate the nearest fire alarm to summon assistance. B. Attempt to extinguish the fire using a fire extinguisher. C. Notify nursing supervisor of the incident. D. Close the door to the client's room to contain the fire. The correct answer is option A. Activate the nearest fire alarm to summon assistance. According to the RACE fire safety protocol, rescue, alarm, contain, and extinguish. Once a person in immediate danger has been rescued, the very next step is to activate the alarm. Option B is incorrect, because using a fire extinguisher is only appropriate after the alarm has been triggered and only if it is safe to do so. Option C is not a priority during the critical first moments of an emergency. And option D, while important for containment, also comes after activating the alarm system. Let us continue with question 5. While preparing to discharge an older adult client who lives alone, The nurse notices that the client frequently asks for information to be repeated and squints while reading printed instructions. Based on these observations, what is the most appropriate nursing action to prioritize the client's safety? Options are A. Refer the client for a professional home safety assessment. B. Emphasize the importance of taking medications as prescribed. C. Ask the client to practice using the emergency alert system. D. Recommend scheduling a routine visit with the primary care provider. The correct answer is refer the client for a professional home safety assessment, as visual and hearing impairments increase the risk of falls and other hazards. An occupational therapist or home health nurse can identify risks and recommend adaptations like grab bars, better lighting, or hearing aids. Option B is helpful but does not address the core safety issue. Option C may be appropriate later but does not target sensory deficits. Option D is supportive but not an immediate priority. Quick reminder before we continue. If you are serious about passing the NCLEX and want a massive boost in your prep, we have something special just for you. For a limited time, we are offering free 5-day access to our all-in-one NCLEX crash course. And yes, we mean completely free. No credit card, no strings, no catch. Just click the WhatsApp link in the description below and type the word "Hi." That is it. Our team will unlock everything for you, including live and recorded NCLEX review sessions, powerful next-gen NCLEX case studies, over 5,000 real exam-style practice questions, printable PDF study guides, expert Q&A support, and personalized study plans. Whether you are preparing in a week or over a month, do not miss this opportunity to supercharge your prep. Completely free for 5 days. Now, let us jump back into the lecture and keep crushing it, one concept at a time. Let us look at question 6. The nurse is providing discharge teaching to a client who has been prescribed a monoamine oxidase inhibitor, or MAOI, for treatment-resistant depression. To prevent serious complications, which of the following foods should the client be taught to strictly avoid? The options are A. Cream cheese, B. Swiss cheese, C. Milk, D. Ice cream. The correct answer is option B. Swiss cheese. MAOIs can cause a hypertensive crisis when combined with tyramine-rich foods like aged cheeses such as Swiss, which can lead to severe headaches, palpitations, or stroke. Cream cheese, option A, is unaged and safe. Milk and ice cream. Options C and D are low in tyramine and not risky unless combined with other high tyramine ingredients. Next, let us take a look at question 7. A nurse is creating a care plan for a client diagnosed with mycoplasma pneumonia to help prevent transmission to others. Which of the following interventions should be included? Options are A. Place the client in a private room with negative pressure ventilation. B. Wear a surgical mask when within 3 feet of the client. C. Use gloves whenever touching the client or the environment. And D. Serve meals using disposable trays and single-use utensils. The correct answer is option B. Wear a surgical mask when within 3 feet of the client. Mycoplasma pneumonia is transmitted via respiratory droplets, so droplet precautions are essential, including mask use within close proximity. The client should also wear a mask during transport. Option A involves airborne precautions, which are not needed. Option C is unnecessary unless contact with body fluids is expected. Option D is not relevant, as the illness does not spread through food or utensils. Now let us move on to question 8. The nurse is providing discharge teaching to a postpartum client recovering from a healing episiotomy. Which of the following statements made by the client indicates correct understanding of how to care for the episiotomy site during recovery? The options are Doc A. It is normal for me to feel pain and urgency when I urinate. B. I will increase my intake of fluids and fiber each day. C. I will wash the perineal area with hot water and soap. D. I should wipe the area in one smooth motion using a washcloth. The correct answer is option B. I will increase my intake of fluids and fiber each day. Encouraging measures to prevent constipation is key in episiotomy care, as it reduces straining and protects healing perineal tissue. Option A is incorrect because pain or urgency during urination may signal a urinary tract infection and should be reported. Option C is unsafe. Hot water and soap can irritate the area. Warm water with a peri bottle and gentle drying is preferred. Option D is also inappropriate. Wiping with a washcloth can harm healing tissue, so gentle blotting is recommended instead. Let us keep going with question 9. A nurse is offering anticipatory guidance to the parent of a 2-month-old infant regarding the recommended childhood immunization schedule. Which of the following vaccines should the nurse explain will be given before the infant reaches 8 months of age? Here are the options. A. Human papillomavirus, HPV B, tetanus, diphtheria, and pertussis, TAPLC, Haemophilus influenzae type B, Hib, and D. Varicella, chickenpox. The correct answer is option C, Haemophilus influenzae type B, Hib. The Hib vaccine is routinely given to infants starting at 2 months to protect against serious bacterial infections like meningitis, epiglottitis, and pneumonia. Option A, the human papillomavirus vaccine, is given during adolescence around 11 or 12 years. Option B, Tdap, is a booster for older children and teens. Infants receive DTaP instead. Option D, the varicella vaccine, is administered after the first birthday, usually between 12 and 15 months. Let us now move on to question 10. The nurse is monitoring a client who has been prescribed amlodipine for hypertension. Which of the following findings would best indicate that the medication is achieving its intended therapeutic effect? Option A, hemoglobin, A1C of 5.6%. Option B, blood pressure of 119/79 millimeters of mercury. Option C, capillary blood glucose level of 88 milligrams per deciliter. And option D, total cholesterol level of 190 milligrams per deciliter. The correct answer is option B, blood pressure of 119/79 millimeters of mercury. Amlodipine, a calcium channel blocker, lowers blood pressure by relaxing blood vessels, and the normal reading confirms it is working effectively. Option A, hemoglobin, A1C, indicates long-term blood sugar control and is unrelated to amlodipine. Option C, blood glucose, is also unaffected by this medication. Option D, cholesterol level, reflects lipid status and is not connected to the drug's antihypertensive action. Let us now turn our attention to question 11. The nurse has just completed morning rounds and received several clinical updates. Based on the potential for clinical deterioration, which client should the nurse assess first? Option A, a client who had an adrenalectomy 24 hours ago and is now restless, with a blood pressure of 98/60 millimeters of mercury B. A client receiving continuous intravenous heparin for a pulmonary embolism with an activated partial thromboplastin time of 70 seconds as C. A client on mechanical ventilation for hospital-acquired pneumonia who was last suctioned 2 hours ago D. A client with a newly placed chest tube for hemothorax and 45 milliliters of bright red drainage in the last hour. The correct answer is option A, a client who had an adrenalectomy 24 hours ago and is now restless, with a blood pressure of 98/60 millimeters of mercury. This presentation suggests early adrenal crisis, a life-threatening condition caused by a sudden drop in cortisol and aldosterone, leading to hypotension, restlessness, and potential circulatory collapse. Option B's partial thromboplastin time of 70 seconds is within the therapeutic range for heparin and not urgent. Option C involves routine suctioning with no signs of distress. Option D shows chest tube output within normal limits and does not suggest active bleeding. Let us now shift gears to question 12. While educating attendees at a community health fair, the nurse discusses risk factors for osteoporosis. Which of the following individuals would the nurse identify as being at the greatest risk for developing this condition? The options are A, a 27-year-old woman who jogs 3 times per week and consumes red wine daily. B, a 60-year-old woman who smokes cigarettes and recently stopped drinking alcohol. C, a 51-year-old man with a history of chronic alcohol use who recently quit smoking. D, a 25-year-old man with asthma who uses inhaled corticosteroids. The correct answer is option B, a 60-year-old woman who smokes cigarettes and recently stopped drinking alcohol. This client has several significant risk factors for osteoporosis, including older age, postmenopausal status, female gender, and tobacco use. Estrogen loss after menopause speeds up bone loss, and smoking impairs calcium absorption and bone remodeling. Although she no longer drinks alcohol, her past use may have already affected bone density. Option A is incorrect since jogging builds bone and the client is still within peak bone mass years. Option C involves a younger male who recently quit smoking, presenting a lower overall risk. Option D refers to inhaled corticosteroid use, which has minimal systemic impact in healthy adults. Let us take a closer look at question 13. A pregnant client at 38 weeks gestation arrives at the labor and delivery unit and reports a sudden gush of fluid from her vagina. The nurse suspects rupture of membranes. Which bedside test should be performed to help confirm that the fluid is amniotic? Option A, transvaginal ultrasound. B, transabdominal ultrasound. C, nitrazine paper test. And D, gram stain. The correct answer is option C, nitrazine paper test. This is a quick bedside tool used to detect the presence of amniotic fluid, which is more alkaline than normal vaginal secretions. When nitrazine paper is exposed to amniotic fluid, it turns blue-green or dark blue, indicating a pH above 6.5 and supporting the diagnosis of membrane rupture. Option A, a transvaginal ultrasound, is used to assess cervical length or early pregnancy, but cannot detect fluid leakage. Option B, transabdominal ultrasound, may show low fluid volume but cannot definitively confirm rupture. Option D, the gram stain, is used for detecting bacterial infections, not for identifying amniotic fluid. Let us go ahead and tackle question 14. During a community health screening, a client tells the nurse they have been smoking 2 packs of cigarettes per day for the past 6 years. Based on this history, how should the nurse document the client's smoking exposure in pack years? Here are the options. A, 3.5 pack years. B, 3 pack years. C, 12 pack years. D, 6 pack years. The correct answer is option C, 12 pack years. The pack year calculation is found by multiplying the number of packs smoked daily by the number of years smoked. So 2 packs per day for 6 years equals 12 pack years. This figure helps assess the risk for conditions like chronic obstructive pulmonary disease, cardiovascular disease, and lung cancer. Option A underestimates the exposure, while options B and D also fail to reflect the full smoking intensity and duration. Let us now take a look at question 15. A nurse is preparing dietary education for a client recently diagnosed with dumping syndrome following a partial gastrectomy. Which of the following instructions should be included to best manage the client's symptoms? Option A, drink small sips of water during meals to aid in digestion. B, your symptoms will likely resolve within 4 to 6 weeks as your stomach heals. C, rest for 10 minutes after each meal to assist with digestion. D, your meals should include dry foods that are low in carbohydrates, moderate in fat, and high in protein. The correct answer is option D. This helps prevent dumping syndrome by slowing gastric emptying and reducing fluid shifts. Option A is incorrect. Fluids should be taken separately from meals. Option B gives false reassurance, as symptoms may persist beyond 4 to 6 weeks. Option C is also wrong. Clients should lie down for about 30 minutes, not 10, after eating. Hey, future RN! If you're watching this, it means you are putting in the work, and we want to reward that hustle. For a short time, we are giving you free 5-day access to our complete NCLEX crash course. No card, no payment, no stress. Just tap the WhatsApp link in the description and message us, "Hi." You will instantly unlock live-in recorded NCLEX review classes, next-gen case studies, over 5,000 exam-style questions, study PDFs, and personalized prep plans. This is your shot to level up. Do not miss it. Moving on to question 16, the nurse is assessing 4 clients during morning rounds. Which client requires immediate follow-up due to a potentially life-threatening issue? Option A, a client with pneumonia on prednisone and a blood glucose of 250 milligrams per deciliter. B, a client on continuous intravenous heparin with a 50% drop in platelet count over 5 days. C, a client with type 2 diabetes reporting burning and tingling in both feet. D, a client with glomerulonephritis and urine output of 20 milliliters per hour. The correct answer is option B. A 50% drop in platelets while receiving heparin is a red flag for heparin-induced thrombocytopenia, or HIT, a dangerous immune-related clotting disorder. It requires immediate action, including stopping heparin and starting an alternative anticoagulant, due to the high risk for stroke, pulmonary embolism, or myocardial infarction. Option A is incorrect because hyperglycemia from prednisone is expected and not immediately dangerous. Option C reflects diabetic neuropathy, a chronic issue. Option D involves low urine output, which is common in glomerulonephritis and not an emergency at this time. Let us now move into question 17. The nurse is caring for 4 clients on a neurological unit. Which client should be assessed first, based on the risk of acute deterioration? The options are A. A client with a basilar skull fracture who has raccoon eyes. B. A client who had a craniotomy and whose Glasgow Coma Scale score dropped from 13 to 11 in the past hour. C. A client with amyotrophic lateral sclerosis requesting no resuscitation. D. A client with Guillain-Barré syndrome experiencing lower limb weakness. The correct answer is option B. A sudden drop in the Glasgow Coma Scale after a craniotomy is a critical warning sign of increased intracranial pressure, bleeding, or cerebral edema. Even a 2-point decline in GCS can signal serious neurological instability and requires immediate action to prevent rapid decline or brain herniation. Option A is incorrect because raccoon eyes are an expected finding in a stable skull fracture unless there are new symptoms. Option C involves advanced care planning, which is important but not urgent. Option D describes early Guillain-Barré symptoms. While progressive lower extremity weakness alone does not take priority unless it threatens respiration. Question 18. Let us now move into a high-priority clinical scenario that requires quick nursing judgment. The nurse is caring for a client under evaluation for suspected appendicitis. While in the room, the client makes several comments to a family member. The question is, which statement requires the nurse's immediate intervention? The options are A. The pain does not feel as bad now. I think it was just a stomach ache. B. Would you mind getting me an ice pack? C. I know I'm not supposed to eat anything right now, but I am really hungry. And D. I wonder if I can still play in the basketball game on Monday. The correct answer is option A. A sudden decrease in pain in a client with suspected appendicitis may indicate a ruptured appendix, a surgical emergency that raises the risk of peritonitis and sepsis. This red flag requires immediate provider notification and vital sign reassessment. Option B is incorrect, as using an ice pack is safe. Option C is not critical. Hunger can be managed with routine teaching about remaining NPO. Option D reflects poor understanding but does not pose an immediate danger. Question 19. Now let us look at a critical scenario involving peritoneal dialysis. The nurse is reviewing lab results and must decide which one requires immediate action. The options are A. White blood cell count of 19,000 per cubic millimeter. B. Hemoglobin of 9 grams per deciliter. C. Calcium level of 8.6 milligrams per deciliter. And D. Arterial blood pH of 7.33. The correct answer is option A. A white blood cell count of 19,000 indicates leukocytosis and suggests a possible infection. In a peritoneal dialysis client, this raises strong concern for peritonitis, a serious complication that needs urgent antibiotic therapy and provider notification. In contrast, option B is incorrect because anemia is common in kidney disease and not an emergency unless symptomatic. Option C is also incorrect as slight hypocalcemia is expected and not urgent. Option D is incorrect because mild metabolic acidosis is a typical finding in chronic kidney disease. Question 20. Now shifting to a high-alert pharmacological emergency, let us talk about digoxin toxicity. The nurse is caring for a client showing signs of digoxin overdose, and the question is, which medication should the nurse anticipate the primary healthcare provider to prescribe? The options are A. Digoxin immune fab, B. Milrinone, C. Amrinone, also known as inamrinoning, and D. Flecainide. The correct answer is option A. Digoxin immune fab. This medication is the specific antidote for digoxin toxicity. It is an antibody fragment that binds to digoxin, neutralizing its effects for safe kidney excretion. Once given, symptoms like nausea, confusion, yellow vision, or arrhythmias usually improve quickly. Digoxin toxicity can occur even at therapeutic levels, especially in older adults or those with kidney issues. Option B, milrinone, and option C, amrinone, are inotropes used in heart failure but do not treat digoxin toxicity. Option D, flecainide, is an antiarrhythmic that can worsen toxicity and is not an antidote. Let us now look at a critical emergency scenario. Question 21. A client arrives with signs of severe intra-abdominal bleeding, tachycardia, hypotension, and a thready pulse, all pointing to hypovolemic shock. The question is, which blood product should be given first? The options are A. Packed red blood cells, B. Platelets, C. Granulocytes, and D. Fresh frozen plasma. The correct answer is option A. Packed red blood cells are essential to quickly restore oxygen carrying capacity and intravascular volume in acute blood loss. This helps stabilize the client and prevent organ hypoxia. In contrast, option B is incorrect because platelets treat thrombocytopenia, not volume loss. Option C is incorrect, as granulocytes are used in severe infections with neutropenia, not bleeding. Option D is also incorrect since fresh frozen plasma is given to correct clotting issues, not to replace red blood cells. Let us now turn our attention to a safety-focused scenario. Question 22. While assisting a client from bed to wheelchair, the nurse notices that the right brake is not holding as securely as the left. What should the nurse do first? The options are A. Ask the client if this has happened before. B. Immediately remove the wheelchair from use. C. Attempt to tighten the brake using a simple tool. And D. Contact physical therapy to request a replacement. The correct answer is option B is correct. The defective wheelchair must be removed from use immediately to prevent falls. It should be labeled and reported per protocol. Option A delays urgent action. Option C is unsafe, as nurses should not attempt repairs. Option D is necessary later, but removing the hazard comes first. Now, let us shift our focus to a question involving legal and ethical responsibilities in nursing practice. Question 23. A hospitalized client informs the nurse that she has a completed living will, and her lawyer will be bringing it in for witness signatures. She asks the nurse to help obtain a witness. What is the most appropriate response? The options are A. I will sign as a witness to your signature. B. Because it is a legal document, you will need to find a witness on your own. C. Whoever is present at the time will sign as a witness for you. And D. I will contact the nursing supervisor for assistance regarding your request. The correct answer is option D. The nurse should contact the nursing supervisor to follow legal and institutional policies, as direct care nurses are often restricted from witnessing living wills due to potential conflicts of interest. This protects both the client's rights and the nurse's role. Option A is incorrect. Direct care nurses usually cannot serve as witnesses. Option B is dismissive and lacks advocacy. Option C risks violating legal standards and could invalidate the document. Let us now move into a pediatric scenario involving a child with signs of throat infection. Question 24. The nurse observes a sore throat, inflamed tonsils, and white patches on the tonsillar surface. The question is, which diagnostic test should the nurse anticipate the primary healthcare provider will order? The options are A. Sputum culture, B. Extended respiratory virus panel, C. Throat culture, and D. Complete blood count. The correct answer is option C. Throat culture. A throat culture is the gold standard for diagnosing bacterial tonsillitis, especially streptococcal pharyngitis when white exudates are present. It accurately detects group A streptococcus to guide treatment. Option A is incorrect. Sputum cultures are for lower respiratory infections. Option B is less useful since viral panels do not identify strep. Option D is nonspecific and cannot confirm strep infection alone. Let us now look at a high-risk pediatric emergency involving epiglottitis. Question 25. A 3-year-old child arrives in the emergency department with signs of respiratory distress, drooling, anxiety, and stridor. The question is, which nursing action should be avoided to prevent worsening the child's condition? The options are A. Auscultating lung sounds, B. Assessing vital signs, C. Administering oxygen via nasal cannula, and D. Inspecting the mouth and throat using a tongue blade. The correct answer is option D. Inserting a tongue blade in a child with suspected epiglottitis is dangerous, as it can trigger laryngospasm and complete airway obstruction due to the inflamed epiglottis. Throat inspection should only occur in a controlled setting with emergency support. Option A is incorrect since auscultating the lungs is safe and helps assess breathing. Option B is essential for monitoring the child's status. Option C is also appropriate. Oxygen should be given using the least distressing method, like holding a mask near the face. Before we continue, here is something every serious NCLEX student should know. We are offering free 5-day access to our full NCLEX crash course, packed with everything you need to pass confidently. Just click the WhatsApp link below and send hi. No payment or card required. You will get expert-led review sessions, live and recorded, NGN-style case studies, 5,000 plus practice questions, printable PDFs, one-to-one educator support, and custom study calendars. Use this free access to strengthen your weak areas and fast-track your success. Now, let us look at a critical safety measure for clients with chronic kidney disease. Question 26. The nurse is preparing to place the client on continuous cardiac monitoring. The question is, what is the best reason for this? The options are A. Hypertension is common in CKD. B. Elevated potassium can cause dangerous arrhythmias. C. Monitoring helps decide when to start dialysis. And D. CKD mimics asystole on ECG. The correct answer is option B. Clients with CKD are at high risk for hyperkalemia, which can lead to fatal arrhythmias like ventricular fibrillation or asystole. Cardiac monitoring helps detect early ECG changes, such as peak T waves or widened QRS complexes, allowing prompt intervention. Option A is incorrect because cardiac monitors do not measure blood pressure. Option C is also incorrect. Dialysis decisions are based on labs and symptoms, not heart rhythm. Option D is incorrect as CKD does not cause false ECG readings. Now let us review a scenario involving oncology clients who are calling to report treatment-related symptoms. Question 27. The nurse is triaging multiple calls and must decide which report needs the most urgent follow-up. The options are A. Reduced sexual desire while taking dutasteride. B. Unilateral right leg swelling while on tamoxifen. C. Hot flashes and night sweats while on letrozole. And D. Bone discomfort while taking filgrastim. The correct answer is option B. Tamoxifen significantly increases the risk of blood clots, including deep vein thrombosis and pulmonary embolism. A report of unilateral leg swelling may indicate a DVT, which is a medical emergency requiring immediate evaluation to prevent life-threatening complications. Option A is incorrect, as decreased libido with dutasteride is a common non-urgent side effect. Option C is also incorrect. Vasomotor symptoms like hot flashes are expected with letrozole and do not require immediate intervention. Option D is incorrect as well. Bone pain is a frequent side effect of filgrastim and is usually manageable unless severe or accompanied by other warning signs. Now let us explore a leadership and safety-focused scenario involving staff behavior. Question 28. The nurse manager is faced with multiple reports during a busy shift. The question is, which situation requires the most immediate follow-up? The options are A. Alleged falsification of documentation for a discharged client. B. A nurse needing help with an incident report from the prior shift. C. A staff member arriving late and out of uniform. And D. A nurse suspected of being under the influence of alcohol while precepting a new hire. The correct answer is option D. Suspected substance impairment is a critical client safety emergency. A nurse under the influence, especially while supervising others, must be removed from duty immediately and evaluated according to facility policy. Option A, while serious, involves a discharged client and poses less immediate risk. Option B, offering incident report guidance, is not urgent. Option C, addressing tardiness or dress code, does not present a direct safety threat and can wait. Let us now turn to a scenario involving medication effectiveness and follow-up care. Question 29. The nurse is reviewing lab results for a client on simvastatin for hyperlipidemia. The lipid panel shows elevated triglycerides and low-density lipoprotein cholesterol levels that are still outside the target range. The question is, what should the nurse do next? The options are A. Review the client's serum creatinine. B. Assess the client's adherence to simvastatin. C. Determine if the client is on a low-sodium diet. And D. Document the results as within expected limits. The correct answer is option B. When lipid levels remain high, the priority is to assess if the client is consistently taking their statin medication, as poor adherence is a common cause of treatment failure. Option A is incorrect since simvastatin is metabolized in the liver, not the kidneys. Option C is unrelated. Low-sodium diets target blood pressure, not cholesterol. Option D is incorrect because abnormal lipid levels should always be documented. Let us now walk through a step-by-step pediatric emergency involving epistaxis, or nosebleed management in a child. Question 30. The emergency department nurse must act quickly and in the correct order to stop the bleeding effectively. The question asks, how should these nursing actions be sequenced from first to last? The correct order is 4 to 2 to 1 to 3 to 5. First, option 4, the nurse should position the child to sit upright with the head tilted slightly forward. This prevents blood from draining down the throat, which could lead to nausea, gagging, or aspiration. Second, option 2, continuous pressure should be applied to the soft part of the nose using the thumb and forefinger for at least 10 minutes without interruption, which helps promote clot formation. Third, option 1, if bleeding persists, the nurse should apply a cold compress or ice pack to the bridge of the nose, promoting vasoconstriction and further controlling bleeding. Fourth, option 3, once bleeding is under control, the nurse can offer the child a small drink of water or a gentle mouth rinse to clear the taste of blood, which improves comfort and reduces anxiety. Finally, option 5, the nurse reassesses the situation to ensure that the bleeding has stopped and no further intervention is required. Now, let us review a key concept in nursing leadership. Question 31. The nurse is discussing delegation and accountability, and the question asks which statement is most accurate. The options are A, nurse managers are accountable for both their actions and delegated tasks. B, they supervise only licensed staff. C, delegation fully transfers responsibility. And D, micromanagement is necessary for safety. The correct answer is option A, nurses remain accountable for tasks they delegate, ensuring they are appropriate, within scope, and properly supervised. Option B is incorrect because nurses are also responsible for supervising unlicensed assistive personnel. Option C is wrong since accountability is never fully transferred. Option D is also incorrect. Effective leadership relies on trust and clear communication, not micromanagement. Let us now focus on a prioritization scenario involving 4 clients. Question 32. The nurse must determine which condition requires the most immediate follow-up. The options are A, a chemotherapy client with nausea and vomiting. B, a client with polycystic kidney disease, reporting hematuria and flank pain. C, a client with aplastic anemia who has a fever of 101.1 degrees Fahrenheit, 38.4 degrees Celsius. And D, a client with pulmonary tuberculosis walking in the hallway wearing a surgical mask. The correct answer is option C. A fever in a client with aplastic anemia is a medical emergency due to the risk of sepsis from severe neutropenia. A temperature above 100.4 degrees Fahrenheit, 38.0 degrees Celsius, in an immunocompromised client must be addressed immediately with blood cultures and broad-spectrum antibiotics. Option A is incorrect because nausea and vomiting are expected with chemotherapy and do not pose an immediate threat. Option B is incorrect as hematuria and flank discomfort are common in polycystic kidney disease unless they present with unstable symptoms. Option D is also incorrect. Ambulating while masked is acceptable for clients with active tuberculosis. Let us now explore question 33 focused on respiratory assessment and accurate documentation. The nurse observes a client displaying abnormal breathing that includes cycles of gradually deeper, then shallower respirations followed by periods of apnea. How should this breathing pattern be documented? The options are A, neurogenic hyperventilation, B, Cheney-Stokes respiration, C, apneustic breathing, and D, ataxic breathing. The correct answer is option B, Cheney-Stokes respiration. This pattern is characterized by rhythmic crescendo-decrescendo in breathing depth, followed by apnea, and is often seen in clients with neurologic injuries, advanced heart failure, or those nearing end of life. Option A is incorrect, as neurogenic hyperventilation involves sustained rapid breathing without pauses. Option C is incorrect because apneustic breathing shows prolonged inspiration with minimal expiration, but does not alternate with apnea. Option D is incorrect, since ataxic breathing is irregular and unpredictable in both rhythm and depth, with no consistent pattern. Let us now review a scenario involving post-operative pain management and patient safety. Question 34. The nurse is caring for a client who is receiving morphine via patient-controlled analgesia following abdominal surgery. The client appears sedated but continues to report severe pain. What should the nurse do next? The options are A, increase the PCA morphine dose, B, administer a prescribed non-opioid analgesic, C, discontinue the PCA and give intramuscular morphine, and D, notify the healthcare provider for further evaluation. The correct answer is option D, sedation. in combination with unrelieved pain suggests possible opioid-related oversedation or opioid-induced hyperalgesia. Administering more opioids without evaluation could lead to respiratory depression. The nurse must immediately notify the provider to reassess the pain management plan. Option A is incorrect because increasing the opioid dose in a sedated client is unsafe. Option B is also incorrect, though non-opioid medication may help later. The priority now is addressing the sedation and safety concerns. Option C is inappropriate, as switching to intramuscular opioids may delay pain control and does not resolve the current issue. Now let us move into a medication safety scenario 35 involving warfarin therapy. The nurse is reviewing a client's home medication list after warfarin was newly prescribed. Which listed medication would require immediate notification of the primary healthcare provider? The options are A. Loratadine, B. Saw palmetto, C. Furosemide, and D. Pantoprazole. The correct answer is option B. Saw palmetto. This herbal supplement is often used for symptoms of benign prostatic hyperplasia, but can increase bleeding risk when combined with warfarin due to its antiplatelet effects. The provider must be notified to evaluate bleeding risk and determine if adjustments are needed. Option A is incorrect, as loratadine is a non-sedating antihistamine and does not affect warfarin. Option C is also incorrect. While furosemide can cause electrolyte imbalances, it does not alter coagulation. Option D is incorrect as well, since pantoprazole does not significantly impact warfarin's metabolism. Let us pause for a quick moment. Preparing for the NCLEX can feel overwhelming, but you are not alone. We are giving away free 5-day access to our NCLEX crash course to help guide you through. There is no payment or catch. Simply click the WhatsApp link in the description and say, "Hi." That is all. You will receive live and recorded class access, NGN-style case study practice, thousands of NCLEX-style questions, downloadable PDFs, educator Q&A, and personalized study plans. Let us help lighten the load. You deserve support. Let us now focus on a preventive health education scenario involving human papillomavirus, or HPV. Question 36. The nurse is conducting a session on how to prevent HPV infection and must identify the primary target group for routine vaccination based on current guidelines. The options are A. Adults over 65 years of age, B. Women during pregnancy, C. Children aged 11 to 12 years, and D. Infants at 6 months of age. The correct answer is option C. Children aged 11 to 12 years. According to the Centers for Disease Control and Prevention, the HPV vaccine is routinely recommended for preteens starting at age 11 or 12, though it may be given as early as age 9. Vaccinating at this age ensures protection before any potential exposure through sexual contact. If the series is started before the 15th birthday, only 2 doses are required, spaced 6 to 12 months apart. Option A is incorrect because HPV vaccination is not routinely recommended for adults over 65 years of age. Option B is incorrect because the vaccine is not given during pregnancy. It should be postponed until after delivery. Option D is also incorrect, as infants are not candidates for the HPV vaccine at 6 months of age. They follow a different immunization schedule. Now, let us review a scenario involving breakthrough cancer pain. Question 37. The nurse is caring for a client with metastatic cancer who suddenly reports intense, severe pain. Which prescription should the nurse anticipate to provide rapid relief? The options are A. Fentanyl transdermal patch, B. Pregabalin, C. Ketorolac, and D. Intravenous hydromorphone. The correct answer is option D. Intravenous hydromorphone is a potent, fast-acting opioid that provides effective relief for sudden episodes of breakthrough pain. It works quickly and is commonly used in inpatient settings for severe pain in cancer clients. Option A is incorrect because fentanyl patches are used for long-term pain control and take 12 to 24 hours to take effect. Option B is also incorrect. Pregabalin treats chronic neuropathic pain, not acute flare-ups. Option C is incorrect as ketorolac, while useful for moderate pain, is not strong enough for breakthrough cancer pain and carries risk of gastrointestinal and renal side effects. Let us now examine a sensitive and critical scenario during a prenatal visit. Question 38. The nurse observes bruises in various stages of healing on a pregnant client's arms and upper back. What condition should the nurse prioritize assessing for? The options are A. Major depressive disorder, B. Iron deficiency anemia, C. Intimate partner violence, and D. Polycythemia vera. The correct answer is option C. Bruises in protected areas like the upper back and arms, especially in different stages of healing, strongly suggest physical abuse. Intimate partner violence is a significant risk during pregnancy and may begin or escalate during this time. It is vital for the nurse to initiate a private and safe screening for IPV using supportive, trauma-informed communication and following facility policies and mandated reporting laws. Option A is incorrect because depression does not typically cause unexplained bruises in concealed areas. Option B is also incorrect. While anemia can cause fatigue and pallor, it rarely leads to bruising without another underlying condition. Option D is incorrect as polycythemia vera is rare during pregnancy and does not typically present with isolated bruises. Now let us focus on anesthesia selection for a pediatric surgical procedure. Question 39. A 3-year-old child is scheduled for incision and drainage of a large abscess on the left leg. Which type of anesthesia should the nurse expect? The options are A. Peripheral nerve block, B. Spinal anesthesia, C. General anesthesia, and D. Local anesthesia. The correct answer is option C. General anesthesia. In children under 6 years of age, general anesthesia is the safest and most effective option for painful procedures requiring full immobility. At 3 years old, the child cannot remain still or tolerate discomfort while awake, making sedation and unconsciousness necessary to reduce fear, ensure safety, and manage pain. Option A is incorrect because a peripheral nerve block only numbs the area and does not sedate the child, which may lead to distress or movement during the procedure. Option B is also incorrect. While spinal anesthesia blocks pain, it does not provide sedation, and toddlers are unlikely to cooperate fully. Option D is incorrect as local anesthesia is insufficient for a large, invasive procedure and does not address the need for sedation. Now, let us turn to a respiratory emergency involving acute pulmonary edema. Question 40. The nurse is caring for a client with a pulse oximetry reading of 86% while on room air. The question is, which oxygen delivery device should be used to provide the highest concentration of oxygen without invasive ventilation? The options are A. Simple face mask, B. Nasal cannula, C. Non-rebreather mask, and D. Partial rebreather mask. The correct answer is option C. Non-rebreather mask. This device delivers up to 90 to 95% oxygen at flow rates of 10 to 15 liters per minute, making it ideal for critical conditions like pulmonary edema, where immediate high-concentration oxygen is needed to prevent respiratory failure. Option A is incorrect because a simple mask delivers only 40 to 60% FiO, too low for a client with severe hypoxemia. Option B is also incorrect, as nasal cannulas provide only 24 to 44% oxygen and are inadequate for emergencies. Option D is incorrect because partial rebreather masks provide 60 to 80% oxygen, less than a non-rebreather. Now, let us examine a high-acuity scenario in the intensive care unit. Question 41. The nurse is caring for a client with necrotizing pancreatitis and must identify the most concerning finding that may indicate a serious complication. The options are A. Bruising around the umbilicus, B. Abdominal pain rated 5 out of 10, C. White blood cell count of 13,500 per cubic millimeter, and D. Decreased breath sounds in the left lower lung field. The correct answer is option D. Decreased breath sounds on the left side may signal a pulmonary complication such as pleural effusion or atelectasis, both of which are known to occur with necrotizing pancreatitis. Due to the pancreas's proximity to the diaphragm, inflammation can extend into the thoracic cavity, affecting lung function and increasing the risk of respiratory compromise. Option A is incorrect because Cullen's sign, umbilical bruising, is a known presentation of severe pancreatitis, but not necessarily a new or worsening complication. Option B is incorrect, as abdominal pain is an expected symptom in pancreatitis, and a pain rating of 5 indicates manageable discomfort. Option C is also incorrect, since a mildly elevated white blood cell count reflects inflammation and does not indicate acute deterioration. Let us now review a question focused on nutritional education for iron deficiency anemia. Question 42. The home health nurse is teaching a client about appropriate food choices, and the client selects a meal. Which option reflects a correct understanding of iron-rich nutrition? The options are A. Cucumber salad with shredded carrots and balsamic vinaigrette, B. Omelette with cheese and toast. C. Lentil soup served with garlic bread. And D. Beef liver accompanied by sautéed kale and wild rice. The correct answer is option D. Beef liver is an excellent source of heme iron, the most easily absorbed form, and pairing it with sautéed kale and wild rice adds non-heme iron and supportive nutrients like vitamin C and folate. This combination promotes optimal iron absorption and red blood cell production. Option A is incorrect because cucumbers and carrots are low in iron. Option B is also incorrect, as eggs and toast provide only small amounts of non-heme iron with limited impact. Option C, while including lentils, relies on non-heme iron, which is less bioavailable and can be inhibited by compounds in grains. Let us now examine a leadership scenario involving patient safety on a surgical unit. Question 43. You are the nurse manager and several clients were nearly transferred for surgery on the wrong day, though no procedures occurred. What is your priority action? The options are A. Commend the staff for catching the errors. B. Initiate a thorough investigation to identify the root causes. C. Report the events as medical errors to risk management. And D. Notify the State Department of Health. The correct answer is option B. Near misses reveal serious system flaws and must be investigated immediately to prevent future harm. A root cause analysis helps uncover what allowed these incidents to happen and guides the implementation of safeguards like staff re-education or updated checklists. Option A is incorrect because while staff recognition is valuable, it should follow, not replace, a formal investigation. Option C is also incorrect, as near misses are not classified as medical errors since no harm occurred. Option D is incorrect because these events do not meet the threshold for mandatory state reporting. Let us now review a clinical skills question involving intramuscular injection technique. Question 44. The nurse is preparing to give an intramuscular injection into the vastus lateralis muscle. How should the correct anatomical site be identified? The options are A. Palpate the greater trochanter and lateral femoral condyle. Divide the distance into thirds and inject into the middle third of the lateral thigh. B. Identify the acromion process and inject 2 finger breaths below it. C. Use the ventrogluteal method by forming a V with the fingers over the greater trochanter. And D. Pull the skin laterally 1 inch before inserting the needle. The correct answer is option A. This is the correct technique for identifying the vastus lateralis site, which is preferred for intramuscular injections in infants and safe for all age groups. The site is located in the middle third of the lateral thigh between the greater trochanter and lateral knee. Option B refers to the deltoid site, which is not used to locate the vastus lateralis. Option C describes the ventrogluteal site, which is unrelated here. Option D describes the Z-track method, which helps prevent medication leakage but does not identify anatomical landmarks. Let us now look at a discharge teaching scenario involving proper eye drop administration. Question 45. The nurse is instructing a client on how to reduce the risk of systemic absorption of the medication. The options are A. Administer the drops before meals. B. Swallow repeatedly while instilling the drops. C. Blink firmly several times after applying. And D. Apply gentle pressure over the inner corner of the eye for 30 to 60 seconds. The correct answer is option D. Applying pressure to the inner canthus, known as punctal occlusion, helps block the nasolacrimal duct, preventing the medication from draining into the nasal passages where it could be systemically absorbed. This technique is especially important for medications like beta blockers that can have cardiovascular or respiratory effects. Option A is incorrect because meal timing does not affect eye drop absorption. Option B is also incorrect. Swallowing does not influence the medication's action. Option C is incorrect, as blinking vigorously may cause the drug to be expelled from the eye. Let us pause for a quick moment. Preparing for the NCLEX can feel overwhelming, but you are not alone. We are giving away free 5-day access to our NCLEX crash course to help guide you through. There is no payment or catch. Simply click the WhatsApp link in the description and say, "Hi." That is all. You will receive live and recorded class access, NGN-style case study practice, thousands of NCLEX-style questions, downloadable PDFs, educator Q&A, and personalized study plans. Let us help lighten the load. You deserve support. Let us now focus on pediatric triage and airway prioritization. Question 46. The nurse is assessing multiple children in the emergency department and must determine which child needs immediate follow-up due to the risk of airway compromise. The options are A, a child with urinary frequency and burning on urination. B, a child with leukemia and petechiae on the torso. C, a child recently diagnosed with acute epiglottitis who is now drooling. And D, a child with otitis media, fever, and crying. The correct answer is option C. Drooling in a child with acute epiglottitis is a red flag for severe airway obstruction. It indicates that the child is unable to swallow secretions due to inflammation of the epiglottis and is at risk for sudden respiratory failure. This requires immediate intervention and preparation for advanced airway management. Option A is incorrect because urinary symptoms suggest a lower urinary tract infection, not an airway threat. Option B is incorrect, as petechiae in leukemia may indicate low platelets, but are not an emergency unless accompanied by active bleeding. Option D is also incorrect. Otitis media may cause discomfort and fever, but it is not life-threatening. Let us now examine a high-priority cardiac monitoring scenario. Question 47. The nurse is reviewing electrocardiogram strips for multiple clients and must determine which one requires immediate follow-up. The options include Strip A showing normal sinus rhythm, Strip B showing sinus rhythm with a premature ventricular contraction, Strip C showing wide, rapid QRS complexes with no visible P waves, indicating ventricular tachycardia, and Strip D showing sinus tachycardia. The correct answer is option C. Ventricular tachycardia is a life-threatening arrhythmia that can quickly progress to ventricular fibrillation or cardiac arrest. The nurse must immediately assess whether the client has a pulse. If pulseless, initiate cardiopulmonary resuscitation and defibrillation. If a pulse is present, prepare for synchronized cardioversion and administer antiarrhythmic medications such as amiodarone. Option A is stable and requires no urgent action. Option B shows a single PVC, which is usually benign. Option D indicates sinus tachycardia, which is less urgent and often caused by reversible factors like pain or dehydration. Let us now review a patient education scenario involving central venous catheter care. Question 48. The nurse is teaching a client who recently had a catheter inserted into the femoral vein. Which instruction should be emphasized to reduce complications? The options are A. Restrict fluid intake to no more than 500 milliliters per day. B. Clean the site daily with soap and water. C. Avoid sitting at an angle greater than 45 degrees. And D. Remove the dressing if it causes itching. The correct answer is option C. After a femoral central line insertion, keeping the head of the bed at 45 degrees or lower helps reduce tension at the insertion site, minimizing the risk of bleeding, dislodgement, or infection. Option A is incorrect, as fluid restriction is not routinely recommended unless medically indicated. Option B is incorrect because clients should never remove dressings or clean the catheter site themselves due to infection risk. Option D is also incorrect. Clients should not remove the dressing themselves, but should report discomfort so trained staff can intervene. Let us now examine a prioritization scenario involving multiple clients with respiratory concerns. Question 49. The nurse must determine which client requires immediate assessment. The options include A. A client with left-sided pulmonary empyema and elevated temperature and heart rate. B. A client with a chest tube showing gentle bubbling during exhalation. C. A client with right-sided pleural effusion and decreased tactile fremitus. And D. A client with pneumonia and an oxygen saturation of 90% while on 4 liters of oxygen via nasal cannula. The correct answer is option D. This client is the top priority because an oxygen saturation of 90% despite supplemental oxygen indicates significant gas exchange impairment and the potential for respiratory failure. This situation demands prompt evaluation to determine if more aggressive respiratory support is needed. Option A, while showing signs of infection and early sepsis, is not immediately decompensating. Option B describes a normal chest tube finding. And option C reflects an expected physical exam result for pleural effusion. Question 50. The nurse is preparing to change the dressing for a client with deep partial thickness and full thickness burns. Which action would be considered inappropriate in this context? The options are A. Administering an oral cyclooxygenase 2 inhibitor 30 minutes before the dressing change. B. Explaining the procedure clearly to the client beforehand to reduce anxiety. C. Handling burned areas gently while changing the dressing. And D. Allowing the client to watch their favorite television show as a distraction during the procedure. The correct answer is option A. Administering an oral COX-2 inhibitor is not appropriate because such medications are not strong enough for the level of pain experienced during burn dressing changes, and their delayed onset does not offer timely relief. In contrast, intravenous opioids like morphine or fentanyl are the standard for managing intense procedural pain in burn clients. The other actions, providing clear explanations, handling the tissue gently, and using distraction techniques, are all appropriate and enhance both physical comfort and psychological coping. Let us now turn our attention to a critical cardiovascular emergency. Cardiac tamponade. Question 51. The nurse is assessing vital signs in a client diagnosed with this condition. Which of the following sets of vital signs best reflects cardiac tamponade? The options are A. Heart rate of 109 beats per minute, respiratory rate of 26 breaths per minute, and blood pressure of 88/71. B. Heart rate of 90, respiratory rate of 32, and blood pressure of 90/52. C. Heart rate of 115, respiratory rate of 22, and blood pressure of 140/78. Or D. Heart rate of 54, respiratory rate of 14, and blood pressure of 161/52. The correct answer is option A. This set of vitals reflects classic signs of cardiac tamponade: tachycardia, hypotension, tachypnea, and most notably, a narrow pulse pressure of just 17 millimeters of mercury. In tamponade, fluid builds up in the pericardial sac, compressing the heart and limiting its filling, which results in reduced cardiac output and compensatory signs like rapid breathing and heart rate. In contrast, option B shows a wider pulse pressure and a relatively mild heart rate, which is not typical. Option C features high blood pressure and a very wide pulse pressure, which rules out tamponade. Option D shows bradycardia and wide pulse pressure, also inconsistent with the condition. Let us now look at a question that tests your understanding of nursing prioritization based on client safety and Maslow's hierarchy of needs. Question 52. The nurse receives the following prescriptions for 4 newly admitted clients. Which action should be implemented first? The options are option A. Initiate intravenous fluids for a client admitted with anorexia nervosa. Option B. Administer venlafaxine to a client diagnosed with persistent depressive disorder. Option C. Contact the social worker to begin discharge planning for a client. Or option D. Draw a blood sample to check a client's lithium level. The correct answer is option A. Initiating intravenous fluids in a client with anorexia nervosa takes top priority because it directly addresses an immediate physiological threat. Clients with anorexia often arrive severely dehydrated and with electrolyte imbalances, placing them at high risk for arrhythmias, hypotension, and even cardiac collapse. Administering fluids quickly is a life-saving intervention that supports circulation and perfusion. On the other hand, option B, while appropriate for managing depression, is not urgent. Option C involves discharge planning, which is important but not an immediate concern at the time of admission. Option D, checking a lithium level, though clinically relevant, does not outweigh the urgency of stabilizing a client's fluid status. Now let us take a closer look at therapeutic group development. Question 53. A nurse is preparing to lead group therapy sessions on substance use disorders at a community center. The nurse is organizing weekly topics and identifying participants. Based on these actions, which phase of group development is the nurse in? The options are A. Working, B. Orientation, C. Termination, or D. Planning. The correct answer is option D. Planning. This phase happens before the group begins and involves outlining objectives, choosing participants, creating schedules, and planning logistics. It lays the foundation for successful group sessions. Option A, working, involves active participation and therapy after the group has formed. Option B, orientation, refers to the group's first meeting where trust is built and expectations are set. Option C, termination, is the final phase where members reflect and say goodbye. Next, let us look at how nurses can support clients facing life transitions. Question 54. A nurse is caring for a client adjusting to retirement, and the question asks which intervention best supports psychosocial adaptation. The options are A. Offer resources for support groups and community involvement. B. Focus only on past accomplishments. C. Schedule family visits without client input. Or D. Avoid discussing retirement. The correct answer is option A. Providing access to support groups and community activities helps the client build new routines, regain purpose, and stay socially connected after retiring. In contrast, option B limits growth by focusing only on the past, option C ignores client autonomy, and option D prevents emotional expression. Now let us shift our focus to geriatric assessment and recognize what demands the nurse's immediate attention. Question point 55. During a routine exam of an older adult, the nurse notes several findings. The question is, which of the following requires the most urgent follow-up? The options include A. Difficulty swallowing food and liquids. B. Occasional urine leakage when laughing or coughing. C. Dry, flaky skin on the arms and legs. Or D. Gradual hearing loss over the past year. The correct answer is option A. Difficulty swallowing food and liquids. Dysphagia is a serious concern in older adults as it significantly increases the risk for aspiration and aspiration pneumonia, which can be life-threatening. It may also lead to malnutrition or dehydration, and may indicate a neurological disorder like stroke or Parkinson's disease. In contrast, option B refers to stress incontinence, which is common and manageable but not urgent. Option C describes dry skin, an expected change in aging that is easily treated with moisturizers. Option D, age-related hearing loss, can affect communication but does not require immediate intervention. Stop scrolling. This is the offer you do not want to miss. Right now, you can get free 5-day access to our NCLEX crash course, but spots are limited. No credit card needed, just hit the WhatsApp link below and send the message, "Hi." That is your golden ticket to live and recorded review classes, next-gen case studies, over 5,000 NCLEX-style questions, PDFs, expert guidance, and study plans for every schedule. Get in while you still can. This free access will not last forever. Now, let us shift our focus to a question about identifying clients at risk for hypothyroidism during community screenings. Question 56. The nurse evaluates several clients. Option A is underweight, anxious, has a rapid pulse, and reports diarrhea. Option B is overweight, sweats during activity, and often feels cold. Option C is obese, has high blood pressure, and reports excessive thirst. Option D is obese, has swelling around the eyes, and feels unmotivated. The correct answer is option D, a client who is obese, has noticeable swelling around the eyes, and reports decreased motivation. These signs, weight gain, periorbital edema, and low energy, are key indicators of hypothyroidism, which is marked by metabolic slowing and fluid retention. In contrast, option A describes hyperthyroidism, not hypothyroidism. Option B lacks strong clinical indicators, and sweating is not typical in hypothyroid states. Option C points more toward diabetes, given the excessive thirst and hypertension. In short, always prioritize clients showing signs of slowed metabolism like fatigue, puffiness, and low motivation when screening for hypothyroidism. Let us move on to a question about the phases of the nurse-client relationship. Question 57. While hospitalized, a client works with the nurse to set individualized care goals. Which phase of the relationship does this reflect? Option A is the orientation phase. Option B is the working phase. Option C is the termination phase. And option D is the pre-interaction phase. The correct answer is option A, the orientation phase. This phase marks the beginning of the therapeutic relationship, where trust is established, expectations are clarified, and mutual goals are developed. Setting these goals early provides the foundation for care planning and collaboration. Option B is incorrect because the working phase comes after goals are set and involves actively addressing health issues. Option C, the termination phase, is when the relationship ends and progress is reviewed. Option D, the pre-interaction phase, occurs before meeting the client and does not include direct communication or goal setting. In short, goal setting with a client signals the orientation phase, where the relationship is built and direction for care is established. Now, let us turn to a medication teaching scenario involving furosemide, a commonly prescribed diuretic for hypertension. Question 58. The nurse is educating a client who has recently started this medication. Which instruction should be emphasized? Option A suggests limiting potassium-rich foods like bananas and potatoes. Option B advises avoiding grapefruit juice. Option C recommends taking the medication early in the day. Option D mentions reporting a persistent dry cough. The correct answer is option C, take this medication early in the day. Furosemide increases urination by promoting sodium and water excretion, and taking it early helps prevent nocturia, which can disrupt sleep. In contrast, option A is incorrect because furosemide causes potassium loss, so clients should actually consume more potassium-rich foods. Option B is also incorrect, as grapefruit juice does not interact with furosemide, unlike with other drugs like statins or calcium channel blockers. Option D is misleading since a dry cough is a known side effect of angiotensin-converting enzyme inhibitors, not loop diuretics like furosemide. Let's move on to a scenario involving a freshly applied plaster cast. Question 59. The nurse is caring for a client who has just received a new cast on their lower leg. Which action by the nurse is appropriate? Option A suggests inserting a pencil or ruler into the cast to relieve itching. Option B advises using a hot hairdryer to speed up the drying process. Option C recommends allowing the cast to hang in a dependent position below heart level. Option D suggests supporting the cast with the palms of the hands instead of the fingertips. The correct answer is option D, support the cast using the palms of the hands. Using the palms prevents indentations in the plaster, which could cause pressure points and impair circulation. Option A is incorrect because inserting objects into the cast can cause injury or infection. Option B is also incorrect, as hot hair dryers can cause uneven drying and burns. Option C is wrong because the cast should be elevated above heart level initially to reduce swelling, not allowed to hang below it. Let's now turn to a question regarding pre-procedure education for a client scheduled for a vaginal and cervical colposcopy with biopsy. Question 60. The nurse must provide the client with key information. Option A suggests avoiding food and fluids for at least 8 hours before the test. Option B states the client will need a driver because they will be sedated for the procedure. Option C mentions experiencing a metallic taste due to contrast dye. Option D advises that the client may experience discomfort with vaginal intercourse following the procedure. The correct answer is option D, discomfort with vaginal intercourse after the procedure. This is expected due to healing tissue after a biopsy and pelvic rest, including abstaining from intercourse, douching, and tampon use, is typically advised for 48 hours. Option A is incorrect, as the client does not need to fast before the procedure. Option B is incorrect because sedation is not required, and the client can drive themselves home. Option C is also incorrect, as colposcopy does not involve the use of contrast dye. Now, let's examine a scenario where the nurse receives a prescription to administer thiamine to a hospitalized client. Question 61. Which condition most likely being treated with this medication? Option A suggests systemic lupus erythematosus. Option B points to pernicious anemia. Option C is Wernicke's encephalopathy. And option D refers to iron deficiency anemia. The correct answer is option C, Wernicke's encephalopathy. Thiamine is the primary treatment for this serious neurological condition, which is often seen in clients with chronic alcoholism or severe malnutrition. Thiamine deficiency can cause symptoms like nystagmus, ataxia, confusion, and peripheral neuropathy. If untreated, the neurological damage can become permanent. Option A is incorrect because systemic lupus erythematosus is treated with immunosuppressants and corticosteroids, not thiamine. Option B is also incorrect. Pernicious anemia results from a vitamin B12 deficiency, treated with B12, not thiamine. Finally, option D is incorrect because iron deficiency anemia is treated with iron supplements, not thiamine. Let's consider a scenario where the nurse is caring for a group of clients. Question 62. Which action should be implemented first? Option A suggests administering prescribed antibiotics to a client newly diagnosed with bacterial meningitis. Option B advises repositioning a client with chronic back pain who reports a pain score of 6 out of 10. Option C recommends removing a nitroglycerin transdermal patch from a client being treated for chronic angina. Option D involves assessing a post-coronary artery bypass grafting CABG client with a serum glucose of 135 milligrams per deciliter. The correct answer is option A, administering antibiotics to the client with bacterial meningitis. This is a life-threatening infection of the central nervous system, and immediate antibiotic therapy is critical to prevent complications such as septic shock, brain herniation, or death. Delaying treatment increases mortality risk. Option B is incorrect because repositioning the back pain client, though important, is non-urgent compared to life-saving interventions. Option C is incorrect, as removing the nitroglycerin patch is a routine, non-urgent task. Option D is also incorrect. A serum glucose of 135 milligrams per deciliter post-CABG is acceptable, and no immediate intervention is needed. In summary, prioritize life-threatening infections like bacterial meningitis, where timely antibiotic administration can make the difference between life and death. Let's now look at a question about advance directives. Question 63. The nurse is explaining to a client the importance of a durable power of attorney for health care. What is the primary purpose of this legal document? Option A suggests it records a person's future preferences for medical treatment. Option B states it appoints a trusted individual to make medical decisions on behalf of the client if they are unable to do so. Option C proposes it authorizes a legal representative to honor family requests in medical situations. Option D says it directs healthcare professionals on specific treatments to provide or withhold. The correct answer is Option B, to appoint a trusted individual to make medical decisions on the client's behalf if they are unable to do so. A durable power of attorney for healthcare, DPOAHC, ensures that the client's medical choices align with their values when they cannot speak for themselves. Option A describes a living will, which outlines preferences for end-of-life care, not decision-making authority. Option C is incorrect because family input is secondary to the decisions made by the appointed healthcare agent. Option D refers to a POL ST, physician orders for life-sustaining treatment, which provides specific treatment instructions but does not assign decision-making power. In summary, the durable power of attorney for healthcare appoints an individual to act as the client's voice in medical matters when they are unable to make decisions themselves. Let's now look at a scenario where a medical surgical question 64 nurse is preparing to admit an older adult client who is hospitalized following a ground-level fall. Which teaching should be prioritized upon admission? Option A suggests instructing the client on how to use the room telephone to place meal orders. Option B recommends reviewing the prescribed medications for the shift. Option C involves explaining the prescribed pain management plan and available options. Option D proposes demonstrating how to use the call light to request assistance. The correct answer is Option D, demonstrating how to use the call light to request assistance. After a fall, ensuring that the client knows how to use the call light is essential for safety. Older adults are at high risk for repeat falls, especially if they attempt to move without assistance. Teaching how to request help is a key fall prevention strategy. Option A is incorrect because knowing how to use the phone for meal orders is not as urgent as teaching safety measures. Option B is important, but not the first priority for a high fall risk client. Option C, while important, should be addressed after ensuring the client's immediate safety. Question 65. Let's now discuss the appropriate use of the diphtheria, tetanus, and acellular pertussis, DTaP, vaccine. For which group should the nurse recommend this vaccine? Option A suggests infants and children younger than 7 years. Option B recommends children over the age of 7 years. Option C involves older adults, and Option D suggests pregnant women. The correct answer is Option A, infants and children younger than 7 years. The DTaP vaccine is specifically designed for young children to protect against diphtheria, tetanus, and pertussis. The primary DTaP series includes 5 doses given at 2, 4, 6, 15 to 18 months, and 4 to 6 years. Option B is incorrect because children over 7 years should receive the Tdap vaccine, which contains lower antigen levels for older children and adolescents. Option C is incorrect. Older adults should receive Tdap, typically every 10 years or after the first dose. Option D is also incorrect, as pregnant women should receive the Tdap vaccine between 27 and 36 weeks of gestation to protect the newborn against pertussis. In summary, the DTaP vaccine is for young children under 7, while other groups receive different formulations like Tdap. Hey there, real quick, we have got something awesome for you. If you are prepping for the NCLEX and want extra help without paying a rupee, we are giving away free 5-day access to our NCLEX crash course No strings, no card, just good vibes and serious study tools. Hit the WhatsApp link below and say hi to unlock. Live classes, NGN case studies, 5,000 plus practice questions, PDF notes, mentor support, and custom study plans. Think of it as your NCLEX cheat code, but legal. Grab it while it is still free. Question 66. Let's now focus on the nursing priorities in septic shock. A nurse is caring for a client in septic shock, and the question is, which nursing action should be the immediate priority? Option A suggests obtaining an order for an indwelling urethral catheter. Option B involves monitoring serum white blood cell count and lactic acid levels. Option C recommends establishing frequent blood pressure monitoring, and Option D advises monitoring capillary blood glucose levels. The correct answer is Option C, establishing frequent blood pressure monitoring. In septic shock, the body experiences profound vasodilation and capillary leakage, leading to severe hypotension and inadequate organ perfusion. Blood pressure monitoring is critical because it helps guide interventions such as fluid resuscitation and vasopressor therapy. Option A is incorrect because while measuring urine output with a catheter is useful for assessing renal function, blood pressure stabilization takes priority. Option B is also incorrect. Although monitoring lactic acid and white blood cell count is important, they don't guide immediate interventions like blood pressure monitoring does. Option D is not the priority either, as glucose control becomes more relevant once the client is stabilized. Let's consider the highest priority nursing action for question 67, a client who has just returned from surgery after a below-the-knee amputation. Option A suggests positioning the residual limb on a pillow to minimize swelling. Option B recommends assessing the surgical site and dressing for signs of active bleeding. Option C involves requesting a referral for early physical therapy. Option D suggests instructing the client on using an incentive spirometer for lung expansion. The correct answer is Option B, assessing the surgical site and dressing for signs of active bleeding. Hemorrhage is a life-threatening complication after an amputation, and prompt identification of bleeding is crucial to prevent hypovolemic shock. Option A is incorrect because elevating the residual limb is important, but not as urgent as monitoring for hemorrhage. Option C, while important for rehabilitation, is not the immediate concern post-surgery. Option D, teaching incentive spirometer use, is important but can wait until the client is stable. Let's examine a scenario where a nurse is reviewing the vital signs of question 68, a client newly admitted with atrial fibrillation. The client's vital signs are temperature 37.5 degrees Celsius, heart rate 92 beats per minute and irregular, respiratory rate 18 breaths per minute, blood pressure 90/56 millimeters of mercury, and oxygen saturation 96% on room air. Which finding requires the nurse's immediate intervention? Option A suggests the temperature, Option B refers to blood pressure, Option C mentions respiratory rate, and Option D focuses on heart rate and rhythm. The correct answer is Option B, blood pressure. A blood pressure of 90/56 millimeters of mercury indicates hypotension, which can compromise cardiac output in atrial fibrillation. This can lead to poor perfusion of vital organs, and the nurse must assess for signs of hemodynamic instability, such as dizziness or weakness. Option A is incorrect because the temperature is within the upper normal range and does not suggest an infection. Option C is incorrect as the respiratory rate and oxygen saturation are normal. Option D is also incorrect because an irregular heart rate is typical in atrial fibrillation, and the rate is within a controlled range at 92 beats per minute. Question 69. Let's review a scenario where the nurse is monitoring a client undergoing chemotherapy with the anti-neoplastic agent doxorubicin. Which assessment findings should prompt the nurse to take immediate action? Option A suggests decreased appetite. Option B mentions elevated body temperature. Option C refers to hair loss. And Option D describes generalized fatigue. The correct answer is Option B, elevated body temperature. A fever in a client receiving doxorubicin is a medical emergency because it could indicate an infection, such as sepsis or neutropenic fever, due to the myelosuppressive effects of the drug, which leads to neutropenia and impaired immunity. Even a low-grade fever should prompt immediate evaluation and broad-spectrum antibiotics. Option A is incorrect, because loss of appetite, though common, does not require urgent intervention unless it leads to severe dehydration or cachexia. Option C is incorrect, as hair loss is a known side effect of doxorubicin, but is not an immediate clinical concern. Option D is incorrect because fatigue is common in chemotherapy, but unless accompanied by other severe symptoms, it does not require immediate action. Question 70. Let's now review a laboratory result for a client with a potassium level of 5.6 milliequivalents per liter, which is above the normal range of 3.5 to 5.0 milliequivalents per liter. Based on this result, which electrocardiogram, ECG change is the nurse most likely to observe? Option A suggests tall peak T waves. Option B indicates ST segment elevation. Option C refers to peaked P waves. And option D suggests prominent U waves. The correct answer is option A, tall, peaked T waves. Hyperkalemia significantly affects the heart's electrical activity, and one of the earliest ECG changes is the presence of tall, peaked T waves, particularly in the precordial leads. As potassium levels rise, further abnormalities, such as widening of the QRS complex or loss of P waves, can occur, potentially leading to life-threatening arrhythmias. Option B is incorrect because ST segment elevation is more common in myocardial infarction, not hyperkalemia. Option C is incorrect, as peaked P waves are associated with right atrial enlargement, not hyperkalemia. Option D is incorrect because prominent U waves are associated with hypokalemia, not hyperkalemia. Question 71. Let's consider a scenario where the nurse is conducting a staff education session about total parenteral nutrition, TPN. Which clinical condition should the nurse identify as a likely indication for initiating TPN therapy? Option A suggests acute appendicitis. Option B refers to gastroesophageal reflux disease, GERD. Option C involves diverticulosis, and option D indicates acute pancreatitis. The correct answer is option D, acute pancreatitis. TPN is often used for clients with severe pancreatitis when oral or enteral feeding would worsen symptoms. Pancreatitis causes inflammation of the pancreas, which is aggravated by pancreatic enzyme secretion, and even minimal oral intake can exacerbate the condition. TPN provides an effective alternative by delivering nutrients directly into the bloodstream while allowing the gastrointestinal tract to rest. Option A is incorrect because appendicitis is typically treated with surgery, and the short period of NPO status doesn't require TPN. Option B is incorrect as GERD is managed with lifestyle changes and medications, not TPN. Option C is also incorrect because diverticulosis is managed with dietary changes, and TPN is rarely indicated unless complications like bowel obstruction occur. Question 72. Let's discuss the appropriate delegation of tasks by a registered nurse, RN, to a licensed practical vocational nurse, LPNVN, and unlicensed assistive personnel, UAP. Which client assignment is most appropriate for the RN to delegate to the UAP? Option A involves a client newly diagnosed with hypothyroidism who needs education. Option B refers to a client with atrial fibrillation, requiring vital signs monitoring every 3 hours. Option C is about a client immediately postoperative following a total hip replacement who reports pain. Option D involves a client being discharged who needs reinforcement of discharge instructions. The correct answer is option B, a client with atrial fibrillation requiring vital signs monitoring every 3 hours. This task is routine and non-invasive, making it suitable for a UAP as long as the client is stable and the UAP is trained to report abnormal findings. Option A is incorrect because teaching about hypothyroidism requires specialized knowledge, which is outside the scope of a UAP. Option C is incorrect, as postoperative clients require ongoing assessment, pain management, and evaluation, tasks that must be performed by licensed nurses. Option D is incorrect because reinforcing discharge instructions involves critical thinking and clinical judgment, tasks that should be handled by the RN or LPNVN. Question 73. Let's review a scenario involving a client prescribed methimazole for hyperthyroidism. Which client report should prompt the nurse to immediately notify the healthcare provider? Option A mentions a body mass index of 23. Option B refers to a complaint of a sore throat. Option C involves a resting pulse of 84 beats per minute. And option D describes the presence of a mild skin rash. The correct answer is option B, complaint of a sore throat. This could be an early sign of a granulocytosis, a rare but life-threatening side effect of methimazole, which significantly lowers the white blood cell count and impairs the body's ability to fight infection. Immediate action, including a complete blood count, is needed to rule out this complication and prevent severe infections like sepsis. Option A is incorrect because a body mass index of 23 is normal and not concerning. Option C is incorrect, as a resting pulse of 84 beats per minute is within normal limits and suggests that methimazole is working effectively. Option D is incorrect because a mild rash is a known non-serious side effect of methimazole unless it's severe or accompanied by other symptoms. Finally, let's wrap up this segment with our last question. Question 74. The nurse in the emergency department is caring for a client presenting with shortness of breath and a productive cough with purulent sputum. The client's arterial blood gas, ABG, results are as follows. pH 7.25, normal range, 7.35 to 7.45. PaO2 93 millimeters of mercury, normal range, 80 to 100 millimeters of mercury. PaCO2 69 millimeters of mercury, normal range, 35 to 45 millimeters of mercury. And HCO3 25 millimoles per liter, normal range, 22 to 28 millimoles per liter. Based on these values, the nurse should interpret the acid-base status as respiratory acidosis. The low pH of 7.25 and the elevated PaCO2 of 69 millimeters of mercury, with normal bicarbonate levels, indicate that the acidosis is respiratory in origin and uncompensated. This suggests impaired ventilation, likely due to a respiratory infection leading to CO2 retention. Options A, C, and D are incorrect because respiratory alkalosis would show an elevated pH with low PaCO2. Metabolic alkalosis would involve a high pH and elevated bicarbonate, and metabolic acidosis would show both low pH and low bicarbonate. Respiratory acidosis is commonly seen in conditions like COPD, pneumonia, or other forms of hypoventilation,